I'm Dr. Yara Tonelli at Brighton Foot and Ankle. We've got Sophie here with us, our certified medical assistant. She's going to help me demonstrate to you guys how to properly put on a wound dressing. Your doctor might have you do these for several different reasons. Typically, obviously, there's a wound present. So I'm going to show you some of the common products your doctor might recommend. Obviously, follow their instructions for whatever they actually specifically recommend that you put on your wounds. We just have Silvadene, which is an antibacterial cream here, and iodine, or otherwise known as betadine as well. I'm going to show you how to use both, okay? So we're going to start with Silvadene. It is more cream-based, so whichever cream that you have, whether it's antibiotic ointment or a gel, first tip is to never use your finger. Obviously, if you can, make sure you're wearing some gloves as well. I would recommend that you use a Q-tip or sometimes a tongue depressor, just some kind of instrument that you're not in contact with the tube itself. So you're going to just take a little bit of this, and then we're going to pretend that Sophie has a wound right here, and then you're just going to put it right in there. All right. And now we move on to the betadine. We really like betadine. It is antiseptic, but it can be messy. A disclaimer about betadine is, as you can see in the bottle, it does have a darker color. When you do put it on your gauze over here, it has a little bit more of a brownish orangish color to it. Just putting a little bit on here, and then you can put it on your wound. Sometimes you want to soak the entire gauze, so I'll show you, but we won't put this on there. You can put a little bit over here and just kind of scrunch it up a little bit, and that distributes the betadine a little bit more on your piece of gauze. All right. If you're going to be using betadine, we recommend try to avoid lighter color socks, because that might stain them, especially white socks. All right, and then you go in with your pieces of gauze. Again, gauze is going to come in different sizes. This is a 4x4. Sometimes you have a 2x2 in different sizes. So you're just going to layer it down. Again, if your doctor has specific instructions on what exactly to put on top, just follow those. This specific gauze can stick to your wound, and sometimes we have you use something called a non-stick gauze, and that's very obvious on the packaging. Okay, and then this is called a cling or a elastic gauze. You're going to start at the base of the toes and wrap around. You're not going to put it on too snug. You're just going to let it lay as it naturally comes, and you can lock around the ankle as well. Again, you don't want it to be too tight. You just kind of make a figure 8 around the ankle to lock it. Sometimes the rolls are a little big, so you can cut them halfway, or feel free to use the entire one, depending on what kind of shoes you'll be wearing. That might take up some space as well. When you end this part, you can feel free to put a little tape to hold it in as well, or you can let it free. All right, and then for this specific wound care, we're going to use something called a Coban. These come in different colors, also different sizes. Again, we're going to be using the 4-inch for the sake of this video. We're going to follow suit, so give yourself a little bit of slack when you're putting this on, and you're going to start at the base of the toes as well. Just like we referred to in our Ace Bandage video, which feel free to check out, you want to start at the base of the toes, you go up, stretch all the way, and go 50%. You're going to make a little wrap around, give yourself some slack, stretch all the way, come back 50%, and follow suit. Feel free to lock the ankle with this one as well. So do that figure 8, give yourself some slack, stretch, relax, and you're overlapping 50% every time you go. You don't want to put it on too snug. Coban does have the tendency to become snug after you put it on. When you're done, you can feel free to either rip it or use scissors. It does stick to itself, such as so. Hopefully this helps.